Assalamualaikum warahmatullahi wabarakatuh. Today we'll be presenting on the topic CSF analysis, differential meninges. We'll explore how analyzing cerebrospinal fluid or CSF, especially looking at the glucose and lactate levels, help us distinguish between bacterial and viral meningitis. Let's begin. CSF analysis is a key tool in the diagnosing infections of the central nervous system and in understanding its metabolism. CSF is a clear fluid surrounding the brain and the spinal cord, and its composition changes when there's infection. These changes can give us vital clues for the diagnosis. Our main objective today are first to understand how CSF lactate and glucose function as diagnostic markers in meningitis. Second, to learn how these markers help us differentiate between bacterial and viral infection.
Good morning. Okay, now let's start with the methodologies. LFS is a collector, a plumber butchers, which is a minimized invasive techniques. A needle is carefully inserted into the spinal column to withdraw a small amount of the fluid. A needle is a careful insert into the spinal cord to withdraw a small amount of the fluid. This sample must be sent to the lab immediately to avoid any dangerous of metabolic markers that are instances of diagnostic, such as glucose, protein, and alkaline levels. Now, moving to the example case, we are describe a 25 years old patient presenting with classic symptom of meningitis, fever, neck stiffness, and protobritis. Her humble punches in performs and the CSF approach cloudily, which is a strong indicator of a bacteria infection. On the right, if you can see the figure, which is a flow chart summaries for produces flows. It's a begin with resequence and informed consent. Patients are allowed into the group one with devices that LP using an IQ that system, and others you can conventional spinal needed. Such a flow, assuming data consider the accurate detection of bacteria, virus, infection thought CSF analysis. Thank you.
Assalamualaikum and hi, my name is Mu'aris Hushari, number metric 2411098. I will share about target output for metabolic markers. Once we have a CFF, several techniques are used to measure metabolic markers. For the technique, first we have spectrophometry. Spectrophometry is usually used to measure glucose and lactate concentration level through a light absorption. If CFF glucose is less than 40% of blood glucose, it often indicate a bacterial infection. Second technique, we have ELISA. ELISA is used to detect specific antibody, antigen related to infection. For example, Streptococcus pneumonia. Next we have HPLC, or we call it high performance liquid chromatography. Quantifies various metabolic in the CFF sample. If lactate level is greater than 3.5 millimole, per liter suggests bacterial meningitis, while below 2.5 millimole per liter is more likely viral. Lastly, we have biosensor biosensor are rapid tool that give you a result in below than 50 minutes. It's very useful in emergency setting. Next, for impact on well-being and organism, accurate and quick CFF analysis is crucial to patient well-being. In bacterial meningitis, the condition is much more dangerous. If left untreated, the mortality rate can be as high as 13%. Even survivors are at risk of long-term complications such as deafness and cognitive impairment. Infection can spread quickly, leading to sepsis and even multiple organ failure. That's why treatment must be aggressive and immediately. Usually, a combination of broad-spectrum antibiotic like ceftriaxone and vancomycin, along with dexamethasone to reduce inflammation. On the other hand, viral meningitis is usually milder and tend to resolve on its own within 7 to 10 days. However, in immunocompromised patients, complications can still arise. Treatment is generally supportive care fluid, rest and pain relief. In several viral cases, especially those caused by herb virus, and antiviral medication may be used. Overall, differentiating between bacterial and viral meningitis using CSF analysis is crucial in ensure to patient get the right treatment quickly, which can be life-saving.